Lower back discomfort affects millions of adults over 60, often stemming not from aging itself but from decreased movement awareness and muscle coordination. Today we're covering 5 fundamental movements reimagined with evidence-based modifications for aging bodies: pelvic tilts for spinal awareness, glute bridges for hip activation, single knee to chest for decompression, piriformis stretches for sciatic relief, and hamstring stretches for posterior chain balance. These movements target neuromuscular reconnection, core stability restoration, hip flexor release, nerve decompression, and postural realignment. When practiced correctly and consistently, they help restore pain-free movement, improve spinal mobility, and support functional independence. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have acute back injury, sciatica, disc herniation, severe osteoporosis, or chronic pain conditions requiring ongoing treatment. Understanding neuromuscular reconnection after 60. Lower back pain after 60 frequently originates from neuromuscular disconnection rather than structural damage alone. As movement patterns become limited through prolonged sitting or reduced activity, small stabilizing muscles around spine essentially shut down, creating compensatory tension in larger muscle groups. This process, called muscle inhibition, causes body to forget certain movements, leading to stiffness, discomfort, and reduced functional capacity. These 5 movements work not through force or intensity but through awareness and reconnection, re-establishing communication between brain, spine, and stabilizing musculature. Each exercise serves as gentle reset for nervous system, teaching body to move efficiently again while reducing unnecessary tension. This approach emphasizes quality of movement over quantity, breathing coordination over repetition count, and mindful awareness over mechanical execution. Research shows older adults benefit more from neuromuscular retraining combined with gentle strengthening than from aggressive stretching alone, making these modifications particularly effective for aging bodies. Movement 1, Pelvic Tilt for spinal awareness. Pelvic tilt represents foundational movement for reawakening communication between brain, spine, and core stabilizers. As bodies age, small stabilizing muscles around spine tend to deactivate during prolonged sitting or reduced movement, creating compensatory patterns causing discomfort. This movement acts as soft reboot, signaling nervous system to reconnect dormant muscles while realigning pelvis, the foundation for all movement patterns from walking to standing from chairs. When pelvis regains movement freedom, pressure on lower vertebrae decreases, discomfort subsides, and posture naturally improves. This isn't stretch requiring force but conversation with spine through slow, mindful motion. Research demonstrates that pelvic awareness exercises significantly improve proprioception and reduce chronic lower back discomfort in older adults by restoring natural spinal curves and reducing compensatory tension patterns. Lie on back with knees bent, feet flat on floor hip width apart. Rest hands gently on pelvis to feel movement. Inhale slowly through nose. While exhaling, tilt pelvis backward, gently pressing lower back into floor as if flattening it, feeling abdominal muscles engage slightly. Inhale again, returning pelvis to starting position without lifting glutes. Keep motion small, slow, and controlled. Perform 10 repetitions, breathing naturally while maintaining awareness of breath movement connection. For deeper awareness, close eyes and feel how lower back gradually warms with each repetition becoming smoother than previous. This practice emphasizes reconnection over perfection, reminding body how to move efficiently while reducing unnecessary guarding patterns. Movement 2, Glute Bridge for hip activation. Glute bridge serves as essential movement for reactivating gluteal muscles, body's primary engine for movement that commonly deactivates after 60 due to prolonged sitting, postural compensation, or chronic pain patterns. This deactivation affects balance, walking gait, and spinal loading during standing and sitting transitions. Each bridge repetition reactivates largest muscle group while shifting workload from lower back to hips and thighs where it belongs. This movement stimulates posterior chain, the muscle network protecting spine, stabilizing pelvis, and preventing falls, critically important for older adults. Research in Journal of Strength and Conditioning research demonstrates that regular glute bridge practice improves hip extension strength by 28% while reducing lower back pain episodes in adults over 60. Beyond strength benefits, this movement restores functional capacity for rising from chairs, climbing stairs, and maintaining upright posture throughout daily activities. Lie on back with knees bent, feet flat on floor, hip width apart, arms relaxed by sides. Inhale deeply. While exhaling, press feet into floor and lift hips, starting with glutes, then spine one vertebra at a time until body forms straight line from shoulders to knees. At top position, squeeze glutes gently and hold 2 to 3 seconds without pushing excessively high, just enough to feel hips working and back relaxing. Slowly inhale while lowering back down one vertebra at a time until spine fully rests on floor. Perform 8 to 10 repetitions, moving with breath rhythm. Place small pillow under lower back for support if movement feels too challenging initially. This practice builds strength from within, helping you stand taller, move steadier, and maintain functional independence. Movement 3, Single Knee to Chest for spinal decompression. Single knee to chest stretch provides gentle spinal reset, particularly for lumbar region absorbing daily tension. This movement gently decompresses vertebrae, opens hip flexors, and reduces pressure on sciatic nerve, often responsible for discomfort radiating from back down leg. Beyond mechanical benefits, this stretch restores diaphragmatic breathing in lying position, particularly valuable for older adults unknowingly holding tension in abdomen or chest. When breathing deepens, muscles relax and parasympathetic nervous system activates, facilitating healing response. Research indicates this stretch improves circulation to lower spine and pelvic region, supporting recovery, flexibility, and even digestive function. This represents invitation to release physical tension, movement fear, and hesitation about potential discomfort, allowing body to realign and restore natural function. Lie flat on back with both legs extended. Slowly bend right knee, bringing it toward chest. Wrap hands just below knee, either behind thigh or on shin, wherever more comfortable, avoiding pulling directly on knee joint. While exhaling, gently draw knee closer toward chest without forcing, letting gravity and breath facilitate movement. Hold position 15 to 20 seconds, breathing slowly and deeply while feeling lower back lengthen and soften into floor. Gently release leg, returning it to ground, then repeat with left leg. Complete 2 to 3 rounds each side. If lying flat feels uncomfortable, bend opposite leg and plant foot on floor for support. This practice emphasizes safe movement reconnection, teaching body that gentle motion is not only possible but beneficial for sustained mobility and comfort. Movement 4, Piriformis stretch for sciatic relief. Piriformis muscle, located deep in gluteal region, when tight or inflamed can compress sciatic nerve, triggering pain traveling from hip down leg, manifesting as dull ache or sharp sensation during simple movements like rising from bed. This stretch directly targets piriformis while creating space in hips, pelvis, and nervous system for improved function. Unlike larger obvious stretches, this works on deeper level, addressing often overlooked source of discomfort. For aging adults, particularly those sitting frequently or experiencing hip stiffness, this movement can provide substantial relief. Recent research links piriformis tension with gait instability, contributing to fall risk in older adults, suggesting that releasing this muscle may improve both pain levels and walking safety. This stretch responds best to calm, intentional movement rather than aggressive pulling, allowing muscle to release naturally at its own pace. Lie on back with knees bent, feet flat on floor. Slowly lift right foot, placing outer edge of right ankle just above left knee, forming figure 4 shape. If this position alone creates stretch in right hip and gluteal region, remain here breathing naturally. Otherwise, gently lift left leg from ground, bringing left thigh toward chest. Thread right hand through space between legs, clasping hands behind left thigh. Use arms to softly draw left leg closer, feeling deep stretch in right hip and outer gluteal region. Hold 20 to 30 seconds, breathing deeply. Slowly release and switch sides. Repeat 2 to 3 times each side. For sensitive hips or knees, perform this seated in sturdy chair with one ankle resting on opposite thigh. This practice emphasizes gradual opening rather than forced intensity, allowing body to release tension at comfortable pace. Movement 5, Hamstring Stretch for Posterior Chain Balance. Hamstrings, long muscles running down back of thighs, form critical part of posterior chain including calves, gluteal muscles, and lower back. When this chain tightens, particularly hamstrings, it pulls on pelvis, disrupts spinal alignment, and contributes to persistent lower back discomfort. Many adults don't have inherently short hamstrings but rather inactive ones losing elasticity from reduced movement patterns rather than aging alone. This stretch serves as gentle reset, reactivating dormant muscles, improving blood flow, and restoring balance across entire posterior system. This movement activates muscle spindles, sensory receptors in muscles and tendons that help brain trust movement again, improving proprioception and movement confidence. Research demonstrates that regular hamstring stretching combined with activation exercises reduces lower back pain while improving postural alignment in older adults. This practice isn't about touching toes but restoring posture, protecting spine, and providing body with flexibility supporting pain-free daily movement. Lie on back with both legs extended. Gently bend right knee toward chest, placing hands behind right thigh. From this position, slowly extend right foot upward toward ceiling, moving until feeling comfortable stretch in back of thigh without requiring fully straight leg. Flex foot by pulling toes toward face, increasing stretch and activating more of posterior chain. Hold 15 to 20 seconds, breathing slowly and evenly. Gently bend knee returning leg to floor. Repeat with left leg. Perform 2 to 3 rounds per side. Alternatively, this can be done seated in sturdy chair by extending one leg forward with heel on floor and gently leaning forward from hips. Avoid bouncing or forcing movement, instead offering quiet, steady invitation for muscles to restore length and function supporting daily activities. Performing movements safely and effectively. Start conservatively with 1 or 2 movements daily, focusing on quality and awareness rather than repetition count. 2 exercises in morning and 2 before bed can create significant change without requiring gym access or equipment. If experiencing dizziness, perform exercises after light meal and maintain proper hydration. Use chair, pillow, or wall for support when needed. Progress is measured by movement quality and consistency rather than flexibility extremes. Bodies respond to regular gentle practice more effectively than occasional intense sessions. Move with intention, breathe naturally, and maintain awareness of how body responds to each movement. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have acute back injury or active sciatica, recent spinal surgery, severe disc herniation, uncontrolled pain requiring medication, severe osteoporosis with fracture risk, or conditions affecting balance and coordination. Even for healthy older adults, start conservatively and progress gradually. Stop immediately if experiencing sharp shooting pain, numbness or tingling down legs, dizziness, or severe muscle spasms. Mild stretching sensation is normal and expected, acute pain is not and requires stopping. Realistic expectations and timeline. Benefits develop progressively through consistent practice. Weeks 1 to 2, learning proper movement patterns, developing body awareness, establishing daily routine. Weeks 2 to 4, improved movement quality, beginning pain reduction, enhanced breathing coordination. Weeks 4 to 8, clearer functional improvements, noticeable flexibility gains, reduced morning stiffness, better movement confidence. Weeks 8 to 12 and beyond, maintain progressive improvements, established sustainable practice, clear functional benefits supporting daily activities, continued mobility enhancement. However, inconsistent practice limits benefits, emphasizing importance of regular gentle movement over occasional intensive sessions. Integration into daily routine. These movements integrate easily into daily routine. Ideal timing includes morning before rising from bed for gentle awakening, mid-morning break for stiffness relief, afternoon energy restoration, evening before bed for tension release, or combined into single 10-minute mindful movement session. Consistency matters more than perfect timing. Choose times working reliably within your schedule, enabling sustainable daily practice that becomes natural part of routine rather than additional burden. Complementary practices for spinal health. These movements work best combined with regular gentle walking, maintaining cardiovascular health, proper sitting posture with lumbar support, frequent position changes during prolonged sitting, adequate hydration supporting disc health, core strengthening exercises when appropriate, and stress management practices reducing muscular tension. Comprehensive approach addresses multiple factors affecting lower back health and functional mobility. Monitoring progress. Track both movement quality and functional improvements. Movement metrics: improved body awareness during exercises, smoother movement transitions, deeper breathing capacity, reduced need for support props, increased comfort holding positions. Functional improvements: reduced morning stiffness, easier standing from sitting, decreased pain frequency and intensity, improved sleep quality, enhanced movement confidence, maintained independence in daily activities. These functional markers indicate meaningful improvements supporting quality of life and sustained independence. Conclusion. These 5 movements provide evidence-based benefits for adults over 60, including restored neuromuscular awareness, improved spinal mobility, reduced nerve compression, enhanced hip flexibility, and balanced posterior chain function. These practices require no equipment, take only 10 minutes daily, and can be performed safely at home with proper attention to body signals. Start with 1 or 2 movements using proper form and awareness. Practice consistently daily. Progress gradually to all 5 movements. Use safety precautions always. Combined with regular activity, proper posture habits, and comprehensive wellness approach, these movements support continued spinal mobility, pain reduction, and functional independence after age 60. Thank you for watching. For specific concerns about appropriate movements for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on mindful movement and pain management for older adults, practical guidance prioritizing body awareness while helping you maintain mobility and independence through gentle, effective practices.